Welcome to Self-Care Strategies for You, this is webinar 2 in 3-part series. I'd like to take this moment to introduce our panelists. My name is Thérèse Lawlor, and my background is social work and long-term care administration, with over 30 years experience working in geriatrics in both clinical and management positions. I've worked in the areas of long-term care, developmental disabilities, adult day programs, acute care, primary care, complex continuing care, community care, and psychogeriatrics. Currently, I'm a psychogeriatric resource consultant with the Scarborough Health Network and the Regional Geriatric Program of Toronto. Charlene Marshall is a social worker with many years of clinical experience in the fields of geriatric mental health, addictions, and forensics. She is currently a psychogeriatric resource consultant with the Centre for Addiction and Mental Health and the Regional Geriatric Program of Toronto. She also teaches at Humber College as a part-time instructor. Tony Schembri is a PRC with the Regional Geriatric Program of Toronto and the Scarborough Health Network in the Central East Lynn. Tony combines 25 years of experience in mental illness, acquired brain injury, and has 2 graduate degrees in education and psychology. So welcome to webinar 2 in the series of 3. This is self-care strategies for healthcare workers. Next slide, please. This webinar acknowledges the impact of COVID-19 is having on the frontline healthcare workers. We are asking you to give yourself permission to take care of your mental health and make yourself a priority. Next slide, please. Please note that this webinar is not intended to be a substitute for professional medical advice. Please keep in mind that there are many helpful clinical services made available for frontline workers in healthcare to assist with mental health impact of COVID-19. This webinar is using a knowledge to practice framework which provides relevant content and resources. Next slide, please. Our goals are to have a self-awareness check-in, our physical and emotional impact of working in COVID-19 environment, changes of the mental health phases over time, and navigating the available resources. Understand the COVID-19 crisis has put all of us under stress and increased pressure in all of our lives. For the first time in our lifetime, we are dealing with a pandemic. Next slide, please. I'm just going to answer a few questions that come up. People ask for the slide deck and the resources, which will be shared with you shortly following the training. This webinar will be recorded and posted on the RGP Toronto YouTube channel. Please type your questions related to the content into the chat box. There will be opportunities for questions and answers at the end of the webinar. Next slide, please. So we're just going to preview a bit of what we covered in webinar 1, and that is the coronavirus. Sorry, the Corona coaster. If you all remember, when we actually talked about a roller coaster, when we get on it, we actually go forward. And when we go forward in the roller coaster, we can actually see all the twists and the turns and the bends. When we go backwards in Canada Wonderland, if you've ever been in the backwards roller coaster, you can recall that it actually goes backwards and takes you through the ride, which can be actually very anxiety and stress provoking, since you don't know where the twists and turns are actually going to be. I think before I do that though, let's just actually take a look at some of the poll questions. So we get an indication of who's here in our webinar with us today. Can you tell us what your role is? If you could click on the one that applies. So we have about, we have 17% nursing, we have 17% PRC, and we have 67% other. Next question, please. How many years of experience do you have working in the field? Click on the one that applies, please. So 13% have just 0 to 5 years. We have quite a variance here. 16 to 20 years is about 38%, and there's over 50% of 20 plus years experience in the field. A wealth of knowledge here on this webinar. Next question, please. Have you attended previous webinars in this series or another series that was offered by the RGP? Oh, 100%. Yes, have. Wonderful. Thank you very much for sharing that info with us. So again, when we mentioned about the Corona coaster, we are talking about that roller coaster that's actually going backwards. Next slide, please. We're looking at changes in mental health burden over time, and we started with the early stage, looking at fear and anxiety, distress, and depressive symptoms in anxiety. We also were talking about the fear zone. We were also taking a look at the different zones that we actually go through as we're actually expressing or going through this anxiety and stress. Next slide, please. Today, we're going to look at the mid-late, which is looking at burnout and fatigue, grief, and substance use. Next slide, please. I want you to take a look at this quote. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. This is by Rachel Ramin. And when we look at actually all of the things that we go through as we're working in this pandemic in healthcare, there are many things where we actually are immersed in a lot of different suffering and different things that are actually not just with our residents and our patients, but also with staff as well too. This will actually take us into looking a little bit more deeply at compassion fatigue and burnout. And for this, I'm going to pass this over to Tony.
Thanks, Thérèse. Compassion fatigue is not the same as burnout. Burnout is a state of physical, mental, and emotional exhaustion caused by a long-term involvement in demanding circumstances. Burnout is a process, not a condition. Origins are usually organizational, and symptoms are directly related to the cause. Next slide, please. As you can see from this diagram by Figley, a foremost researcher in compassion fatigue, he notes that the process starts almost imperceptibly. Workers begin to have concern with their abilities as the work exposes them to increasing amounts of suffering, but they really don't see it coming. Figley's model illustrates workers' empathic responses grow, and they do this by detaching so that they can really get optimal focus for what they need to do. The good thing is people get a sense of satisfaction from being able to help and do good and support. However, this prolonged exposure to this suffering taxes people more, and Figley believes eventually these progress to residual compassion stress. Cumulatively, with over life demands and other triggers, traumatic memories result in compassion fatigue. Next slide, please. Even though the research indicates compassion fatigue does differ from burnout, they both still take a toll on health workers' lives. Compassion fatigue tends towards suddenly and grows over time. Compassion fatigue grows without any exposure to trauma. Burnout builds over time and does not suddenly occur. Burnout affects both family members and caregivers. And so, for example, if you were to look at exhaustion, cynicism and detachment, reduced self-efficacy. So it's interesting because the cynicism in something that I notice is that I get really cynical about certain things. And that to me is a sign that maybe there's something going on. And maybe it's, compassion fatigue, or burnout is rearing its ugly head. Next slide, please. So even though the research indicates compassion fatigue can increase the risk of depression and suicide among helpers, can increase a relationship strain and conflict, can lead to increased alcohol and substance abuse, increased risk of physical illness in helpers, and can cause high turnover rates and impair professional judgment and increase in patient dissatisfaction. Next slide, please. We have a list of resources for compassion fatigue and burnout. The ones I really enjoyed are the last two, help with self-compassion origins. And I found that that is something that Dr. Kristen Neff has, and it explores all kinds of different self-guided meditation exercise, receive mindfulness compassion training. What is self-compassion? It's actually, I found that quite good. The other was the Rick Hansen one for Grief and Net. That's also a very good resource. Next slide, please. Grief is the emotional, psychological, and physical reaction to death or loss. It is healthy, a natural reaction. When a long-term care resident and staff members feel the loss of the relationship they had with that person, they also frequently experience a loss of the relationship with that person's family and friends. Everyone experiences grief differently and have a different reaction to the loss or death of a person. Grief may cause a range of emotions. Some common ones include anger, sadness, depression, loneliness, hopelessness, and numbness. At times, I've felt actually somewhat numb, especially when I try to deal, or I don't, because I'm a man, I tend not to see grief, or I tend not to enjoy grief, really. Next slide, please. Loss and grief experienced by healthcare providers is frequently not recognized, acknowledged, or supported. Unattended grief and lack of support in managing grief can take a heavy toll on caregiving staff. This unintended grief can lead to compassion fatigue. When there are multiple losses and grief is not addressed, the risk of compassion fatigue and staff burnout increase exponentially. Unattended grief in healthcare staff may compromise the long-term physical and emotional health of staff. Talk about working in an environment that can really cause you harm. Who are not given the support to acknowledge and manage their loss and grief in healthy ways will have increased issues and problems. Some of these problems include staff turnover, absenteeism, reduced staff morale and camaraderie, and a result in staff shortages. Next slide, please. Some resources here that I really enjoyed were the Somerville grief, and that was actually quite helpful. I found that, and the grief resources from the RNAO, but the one that the Somerville has, that one from the Heart House Hospice, is the best thing ever said to a griever, and 64 of the worst things ever said. Those are really good sites to visit. Next, my colleague Charlene Marshall will talk about substance dependence and addiction. Thank you.
Thank you, Tony. Good afternoon, everyone. So this slide here, we're not going to do an in-depth discussion about substance dependence and addiction, but we are going to relate it to the current COVID-19 crisis. So I just want to talk a little bit about, before I get into the slides, that Nanos conducted a survey at the beginning of the pandemic, and it was summoned by the Canadian Centre on Substance Use and Addiction. And it was, individuals were randomly called across Canada, actually, and there was the margin of error for this survey was plus or minus 3.1 percentage points. And what they did is they surveyed 1,036 Canadians 18 years of age or older between March 30th and April the 2nd. And they asked them about how the COVID-19 crisis had impacted their use of alcohol and cannabis. So the survey reported that people increased their use of alcohol, and the reason being was 44% of the people researched was due to stress of the COVID-19 crisis. People also reported increased use of cannabis, and 56% of the people that were asked explained that it was also due to the stress of the COVID-19 crisis. So I don't know if we remember back in March, April, when the province of Ontario was looking at what to deem an essential service. And they actually consulted with many specialists from the Canadian Centre on Substance Use and Addiction and different Centre for Addiction and Mental Health, because the province of Ontario acknowledged that substance dependence and addiction is a reality for many individuals, and by denying them access to alcohol and cannabis, it would have produced undue hardship. And that's why the LCBO was made an essential service, actually. So I think it's really important to acknowledge that when we talk about substance dependence and addiction, there is a large prevalence in the population, and it's been exacerbated by the COVID-19 crisis. I also want to say that there's a lot of stigma attached to talking about substance dependence and addiction. And I know for myself as a consultant, when I spoke to a lot of the healthcare staff that I work with, many of them reported to me in confidence that they started to drink alcohol after their shift so that they could go to sleep. And that started in March, April, and here we are now in August. So the challenge then becomes maybe 1 or 2 glasses of wine helps with sleeping. And now we're here in August, the person may have developed some tolerance to alcohol and needs more of the same substance to get the same desired effect. So when we talk about substance dependence, it can be confusing because it involves physical and psychological components. And for many individuals, psychological dependence occurs when a person feels that they need the substance to function or feel comfortable. And I'd also like to put it in the context of our webinar today, because many staff have reported to me that it helps them cope with their uncomfortable emotions related to anxiety, fear of COVID-19, stress, anxiety, depression, and possibly compassion fatigue. The challenge with substance dependence is that the physical dependence occurs when a person has adapted to the presence of a drug. So they build up a tolerance and they need more and more of a substance to get the same effect. So this is the slippery slope when we talk about using substances over a long period of time to cope with some very challenging emotions. So next slide, please. So this is a picture of our brain. And again, the Harvard Health Letter here talks about why do people use substances? Well, if you're to ask somebody, why do you use your substance? Oftentimes, very plain, they will say, because it makes me feel better, even if it's in the short term. And actual addiction medicine does look at the neuroscience behind this. And studies have shown that addictive substances do create a reward circuit in the brain, and the brain keeps a memory. These positive chemicals that are released encourage individuals to do it again and again. And these lasting memories link the substance to a pleasurable reward circuit. So this is why people often want to continue to use whatever substance to recreate that pleasurable reward circuit. And this makes recovery very difficult because there are some positive benefits from using a substance, particularly when you're under a lot of anxiety and stress. People report that. Next slide, please. So how do you know that there's a problem? How do you know that someone has a substance use problem? And this webinar certainly is not a complete addiction medicine assessment. However, it's important to recognize that the problems may not be so obvious. In my experience talking with staff, they would often underreport the amount of substances they were actually using. Again, because of stigma. But the simplest way to determine whether a person's substance use is having an ongoing negative impact on a person's life or on the people around them is to really look at, does the substance use impact the various activities of daily living and daily functioning? It's important to also remember that these negative impacts can go far beyond the immediate symptoms and eventually affect every aspect of a person's life. Certainly one's physical and emotional health, there's a lot of comorbidities related to substance use problems. Thought process, if a person has an underlying depressive or anxiety disorder, the substance use will exacerbate that. Impact on social and family life. Certainly can also impact a person's housing situation, finances, and their ability to live independently. So it can be very far-reaching in many domains of an individual's life. Next slide, please. So this is a very short list. This is by no means exhaustive, but if somebody is interested in reaching out to get literature or services, there are many services available. Certainly the Center for Addiction and Mental Health, where I'm employed at, has an addiction medicine department. And the each LHIN, Local Health Integrated Network, also has a portal that individuals can access the direct services that way. And the Canadian Centre for Substance Abuse and Addiction has wonderful resources on all the various substances and the impact of substance use and mental health during COVID-19. So there's a lot of information there, and I've actually gone on several of these websites myself to prepare. They have some really helpful posters that are just very simple, and it talks about the impact on a person's mental health when they use various substances. Next slide, please. So we've been talking in webinar 1 and now in webinar 2, we're looking at the changes in mental health burden over time. And today we're looking at burnout and fatigue, grief, and substance use. And in our next webinar, we will be talking in the post section, post-traumatic stress symptoms, depressive symptoms, and a more intense look at substance use. Next slide, please. So this is, I'd like you to take a moment just to reflect on that, because reflect on this slide. The next section, we're going to talk a little bit about how self-compassion can help cope with all of these challenges that healthcare workers are experiencing during the COVID-19 crisis. And this is taken from a workbook called the Mindful Self-Compassion Workbook, written by Christian Neff and Christopher Germer. So the quote reads, "A moment of self-compassion can change your entire day. A string of such moments can change the course of your life." It's very powerful and very, very soothing quote. Next slide, please. This is another one written by the co-author. "Treat yourself as you would treat a good friend." During this pandemic, we've talked about the emotional roller coaster, and certainly all of us have been impacted by the COVID-19 crisis, and will continue to be impacted as we move forward. So this is a really good reminder to not be so hard on ourselves and self-critical. Next slide, please. So self-care and self-compassion are really helpful in managing grief. We've talked today about compassion fatigue and grief and loss, And self-care and self-compassion can help offset some of those very strong emotions. This is a lovely quote here. If your compassion does not include yourself, it is incomplete. This is a Buddhist proverb. Grieving can be emotionally and physically exhausting, a fact which makes self-care and self-compassion vital after a loss. And I just want to put this in the context of healthcare. Several of the staff that I work with have shared with me that at the beginning of the pandemic, they were in crisis mode. There was a lot of loss of human life and a lot of very serious things going on. So they really were like, they shared with me, they were like autopilot. They just worked and they were in a survival mode. And now that the crisis is moving more into a recovery phase, many of the staff have reported that they are feeling completely exhausted. And many of them have actually taken some time off to help manage this feeling of numbness and sadness and emptiness. And this is why we thought about this webinar, because this self-care and self-compassion will really help replenish after this type of loss that healthcare workers and others have experienced. As well, people who are grieving have often spent considerable time caring for their loved one and may need to recover from the physical, emotional, psychological, and spiritual demands of those efforts. And we recognize as well that healthcare workers may also have multiple caring roles: parents, caring for a senior, caring possibly for somebody ill. So people wear multiple hats and may be caregivers in multiple domains of their life. And the caregiver burden can be quite high. And that's why developing self-care and self-compassion helps to build resilience and aids the process of moving into the new normal. So it's really important to replenish and to fortify oneself as we move forward into the new normal. Next slide, please. So this is a nice summary again of what it is. And the idea here is the overarching principles is of compassion. So an attitude of compassion, care, kindness for self in body, mind, and spirit, rather than a harsh self-criticism or a to-do list. And I would like to just share with you that I know for me, I tend to be a doer, and I've been throughout the pandemic and daily, I say to myself, I'm doing the best I can under very difficult circumstances. Self-care and self-compassion is going to be as unique as each one of us are. Each person is going to require a different type of self-care and experience self-compassion on an individual basis. And that's why it cannot be a one-size-fits-all. But certainly self-care and self-compassion is a wonderful way to ease the effects of the life challenges rather than a way to disconnect or build defenses. So it's a way to, the way I see it, it's a way to recover and replenish. And the way I often think about it, it's like falling down, and the self-care and self-compassion allows me to get back up and come back to an equilibrium. In saying that, a personal practice does take time to develop. And again, it's not a one-time event. This is a journey, and we're in August as of today. And certainly as we move forward, the pandemic remains and many of the challenges remain. So it's like pacing yourself and recognizing that this will be a long-term journey. And an underpinning here that's very important is that life is fragile, flawed, and imperfect. And it's important to acknowledge that. And as human beings, we are also imperfect, rather than assuming that perfection is to be the goal, because it's hard to be perfect, particularly at any time, particularly during the COVID-19 crisis. So I find this self-care, self-compassion to be a very effective strategy to help replenish and continue self-care. Next slide, please. So this is another way of looking at what to do. So again, it's going to be as unique as all of us are. Do comforting, soothing things for yourself throughout the day. And again, it needs to fit your schedule. Many people work shifts. Many people may have, different schedules. Your personality, some people are more introverted, some people are more extroverted. It depends on what works for you. There's no cookie cutter approach. It also depends on your energy level. Some days you may have more energy than others, and certainly your preferences. In saying that, it's important to stay connected with supportive people in your life, whoever they are. And that can be done through texting, emailing, telephone, and certainly all these virtual platforms, webinars, Zoom platforms, Microsoft Office, whatever platform you're able to access. And I particularly like this next slide because this is something we can control in terms of making simple, healthy lifestyle choices, like going for a walk in nature, preparing some nutritious food for ourselves. Also recovering with pets. And another way to look at, and yoga can also be positive, and laughing is also a good thing. Pampering yourself. Again, this will depend on individuals' comfort level, but there's different modalities, body work, there's something called Reiki, therapeutic touch, aromatherapy, hand and foot massage, or other therapies that you may find helpful. Myself personally, I enjoy acupuncture. This next one is really important. At the beginning of the pandemic, I get up at 6 every day, and I would watch 2 hours of COVID-19 news before I started my day at 8 o'clock. Not a good way to start my day. I've now limited my time with the world and local news on TV, radio, and newspaper in recognition of my own vulnerability to grief, that there are no good stories on the news. Allow yourself time to recover your energy, capacity, and interest in the world around you. A period of cocooning is normal. And I know that the pandemic has been very challenging and stressful, but I know for myself, there have been some positive things that I've been able to take from this time. And the cocooning, like more time cooking, baking, things like that. Also, embrace hobbies of interest, whether I know when the golf courses opened up with the province of Ontario, a lot of people were very excited about that. Book clubs, general interest, whatever interest that you have that brings you joy and the beauty of life. Life is beautiful, and to reclaim that joy and interest is really important. Next slide, please. So this next slide here is an actual exercise, and we would invite you to do this in the comfort of your own home or office in private. We recognize this is very personal, but the exercise again is taken from the Mindful Self-Compassion workbook. And if you're a caregiver, it's very important to make wise choices of activities to engage in so that you do not become overloaded. Like, what can you take off your plate and what can you put on your plate so that it helps you? Although it's impossible to get rid of stress entirely, there is a lot that we can do to help ourselves. So the exercise involves, in each of the life domains, identifying the helpful behaviors that you currently engage in that actually help you cope with the stress of being a caregiver, and also recognizing those unhelpful activities that actually add to your stress level. And then take note of any new ideas for change you might like to make in the future to take better care of yourself. So again, this is an invitation at your own comfort level, but we've talked a lot about in this webinar series about taking a mindful pause to pay attention. And I know for myself, during the COVID-19, I took a course at CAMH, Center for Addiction and Mental Health, on mindfulness. And the first step of that was just to pay attention of what I was experiencing. And that was step number one. Next slide, please. So this is the exercise. And again, we're asking you to do this on your own time and in your own privacy. But just for the sake of explaining the exercise, I'm actually going to share with you myself. and how I started, how I use this, and I continue to use this. This is an ongoing process. So when it comes to the physical, I've put on a fair bit of weight over the pandemic because of eating and not being as active. So I've trying to manage by being more mindful of my eating habits. Exercise. In our working group, we have a fitness instructor who leads us through a weekly exercise class after our meeting, and it's very helpful. And it's also very nice to exercise with our colleagues. Sleep, and trying to keep good sleep habits as well, that I turn the screen off at a certain time and try to do a restful activity so that I can have a good night's sleep. So some of the things that have been helpful are the exercise, the mindfulness. The areas for me that I still need to work on is movement, exercise. And again, that's a work in progress, and I will continue to work on that. The psychological activities, I've shared with you that I took a mindfulness course at CAMH, and we continue to meet weekly. This has been invaluable because we take stock of where we are today, and we continue to build on the strengths that we've made, and I have found that to be very, very helpful. The other thing that I have found to be helpful is spirituality. I attend a church, and we've been in virtual services since March. And a big part of our service is looking at the joyful moments in our life, focusing on joy and gratitude. And I have found that to be extremely helpful. Again, I'm not perfect. Some days work better than others, but it certainly helped me manage through the pandemic, and these are practices I will continue to work on. Under relationships, certainly the pandemic, there's been a positive for myself. I live with my daughter, she's 23, and both of us have been home. So the pandemic, we've actually bonded. So we've been able to form a more positive relationship because of working from home. The area that is unhelpful and changes I would like to make is I haven't been socializing for my own fears of COVID-19. So this is something I would like to work on with safety measures, of course. Work at the beginning of the pandemic, I was on the computer all the time, the telephone. And now I'm trying to manage my workday to a more reasonable hours in the day on the computer, and also to try to get up out of the chair and take some walks, some mindful walks on the balcony, and to take some breaks to look at the sky and the green and refrain from the computer screen. So I invite you to look at this. It's a helpful way of sort of taking a pulse and saying, okay, what are the areas that are working well, and what are the areas I would like to change or do things a bit differently. So I hope that you're able at some point to take a look at that and that you find that helpful. And again, we'll put the workbook in the chat box so if people would like to follow up directly. Next slide, please. So today we've been talking a lot about practicing self-compassion, and it's a very important concept to talk about self-kindness. So really, self-kindness is about treating ourselves like a friend in need. You know, as Tony was saying, our inner dialogue, we're often very critical of ourselves. Accepting where we are in this moment, where we are today, with no judgment. Acknowledging our pain instead of judging, diminishing, or avoiding it. And I know, you know, for myself as a caregiver and as a social worker, I like to feel that I have, you know, that I'm immune to these emotions, but I'm certainly not immune to these emotions. I've acknowledged I've had some real difficult challenges during the pandemic, and I will probably have many more. Embracing common humanity, accepting that we are not alone in our pain and grief. All of us in healthcare and in our broader community are going through this experience. And sharing our suffering with others and finding peace in our shared human experience collectively can be a very powerful way of coming together, much like this webinar. And then, of course, practicing mindfulness, paying attention, accepting our feelings as they come, and noticing them without judgment, not ignoring them, and not being self-critical as well, paying attention. So I think that brings us to our end of our actual slides. We would like to turn it over to the audience, and I will hand it over to Thérèse. Thank you.
So I guess well, a couple of questions that we have for you is was this helpful for you, and are there other topics that you'd like to see? But one of the things that I was thinking, Charlene, when you were talking is I know that we all have different ways of kind of using strategies that kind of help us to kind of cope. I know one of the things that I really like to do, which actually relieves a lot of stress, is to take the dog for a walk through nature. And so through, looking at the forest and looking at all of that, it's a very calming effect. I'm wondering with some of our panelists that are on the webinar here with us, maybe you have some suggestions as to what are some recommendations that you have or that you use to actually to help you through times of stress. Are there certain things that you find are beneficial? So if you have a minute, maybe you could put that in the chat box. Oh, yes. Mario says, bike riding has helped me out significantly. Absolutely. And it's a really good point as well, too, because it's a very healthy option for actually dealing with some of the stress components that we have. Absolutely.
Thérèse, I found something that I find interesting, and I did it through practicing mindfulness. And that's, can you believe it? Mindfulness eating of chocolates. I gotta tell you, I was so happy when I heard that. I thought, wow, I gotta practice that. And it actually helped. It was a teaching moment for myself because it kind of married two things: mindfulness, learning how to do it, and eating chocolate.
There you go. So I know, Charlene, we had a couple of questions too. Did you?
Yeah, so certainly, well, what came up was what signs have you noticed in yourself that may make you think that you're experiencing compassion fatigue and or grief?
Mm-hmm. Are there any that maybe in the chat box you might want to put in some things where you've noticed where you're actually experiencing fatigue or for burnout or compassion fatigue? I know for myself, I know that I get tired very quickly, right? Because you're running around so much. And there's so many, webinars and Zoom calls and et cetera. So there's a really consistent pattern of actually a constant go, go, go. And because not only do I work in geriatric care, but I also care. I'm also the primary care provider for my mother, who's actually frailer. So there's a kind of there's a balance that has to be made there. And again, it's kind of balancing all of that. So that's why it's really important to find out what are some of the helpful things can actually help you with coping.
Great that you said balance.
Yes, balance, absolutely. And Hazel has put in here too, which is very true. The day can be very long with all work-related tasks having to do. So absolutely, the more ideas that we have for using self-care for ourselves, the more beneficial it is for all of us, actually, right? And some of you, actually everybody has very constructive and very healthy things to kind of relieve that stress. Okay.
Yep.
Charlene, do we have any more questions?
There was the question earlier was, do you feel overwhelmed with the COVID-19 crisis in terms of the healthcare environment, and also, looking at where we are today and with the ongoing, the talk of COVID-19 and the phase 2 and back to school and all the multiple roles that people are juggling.
Absolutely.
Marilyn commented she finds work longer. I find that I can't separate. I used to be able to go home and not work. I would be at home. Now I can't tell the difference.
Yeah.
True.
Yeah,
True.
absolutely.
Yes.
Yeah, absolutely. I think we're all kind of, and the other thing too that we used to have was, when you think about it too, during pre-COVID times, then the times that we went from one facility into another facility, we had that driving time to kind of regroup and to breathe and et cetera. Now we don't. We go from one Zoom call into another Zoom call, which is actually with no time to kind of really to breathe. So absolutely, this COVID-19 is certainly certainly testing, I think, all of us for sure. Yeah.
That old proverb is, be careful what you wish for, you may actually get it. Well, I thought the driving, really, I could do without it. I really like the driving now.
Yeah. And because that driving gives you that time to kind of rewind, right? Like unwind and kind of, get that out of your system for sure. Is there any more questions there, Charlene?
Yeah, well, just one was about the social isolation. And again, that fits in with the fear and anxiety of COVID-19. So how people feel isolated, and that's a challenge.
Absolutely. And I guess the question is too, what are some strategies that some people who have felt isolated, what have you done to actually, make that less of an impact stressfully? I know one definitely is doing, especially in long-term care, you have some of the residents who actually now have family members now or prior to were coming to the window and kind of visiting or doing the iPods and having that kind of conversation. And I think for some of us, you're looking, well, certainly Zoom is one of the things that definitely we have that interaction with for sure. Yeah, absolutely.
Yeah.
Can I get the next slide, please? So again, today's topic was certainly a lot to reflect upon. And I know that there's a lot of information in what we've provided today. Our hope and our takeaway is that you actually will take the resources that we've actually provided in the different sections, and they will, when you receive them in your email, then when you click on the link, you will be able to go directly to that link to get more resources. So definitely, we certainly hope that this will be helpful to you and beneficial for you. Can I have the next slide, please? Okay. So on behalf of Tony, Charlene, and myself, we'd like to say thank you for attending today. Our next webinar will be on August 25th. That will be the third webinar in the series. You will receive a short evaluation survey by email. And so please share your suggestions and topics for any future webinars that you may feel that would be beneficial to you. There's also an evaluation survey link that will be there as well too, and you just click on that. So again, if we can ask you to fill out that survey and send it back, that would be great. Remember too that you will definitely be able to see this on the RGP YouTube, and you can certainly share with other healthcare providers as well too. So on behalf of all of us, we would like to say thank you very much for joining us today. We hope that we will see you on August 25th. Take care and stay well. Thank you.
Take care.